of Washington in Seattle. Dr. Lam currently works in Dallas, Texas. And thank you for joining us, Dr. Lam.
Yeah, thank you for your kind introduction. Yeah, that's pretty much it for the meeting. Any questions? That's all I got. Just kidding. Yeah, so long story short is, like, I'm sure, like, my story is not, certainly not unique. But, it's one way to get, to medicine amongst, many others. Yeah, so, I think looking back and trying to see what I can, what advice I can give you guys. And I used to be in your shoes a long time ago. So I think a lot of it has to do with luck. Like you got it's very cliche, but they always say you gotta be in the right place at the right time. And to me, fortunately, I feel like I was in the right place at the right time, and I met the right people that motivated me and helped me along the way. Besides my family, obviously. But yeah, so at community college, and throughout your undergraduate education, it's very important to seek out people of like-minded people with similar goals. Not because you want to take advantage of anybody, but it's like when for example, like I like palm trees, and so I joined a Facebook group for people who love palm trees. So it's the same thing. So I joined the AMSA club, and I met a lot of great people there. And also I met one of my best mentors, Dr. Kenneth Kubo, who was teaching at the time, and he became one of my my most he's one of my most respected professors, and he helped me a lot to get my foot in the door at the Stanford summer program. So that's what I meant is the role of mentors are very important, and when you join these clubs and you join these organizations, these opportunities and these people will cross your path, and I think it's very important, and they'll be priceless in terms of shaping you to be the kind of person you are, or you will be, and also to help you achieve your goals. So when after the summer program, I made more connections, and that helps with the future applications as well. And after I transferred to the four-year university, so to me, it doesn't really matter where you go in terms of looking back. I think it doesn't really matter what kind of the prestige of your undergraduate education. To me, I've seen so many people who got into Stanford Medical School, for example, who didn't attend an Ivy League, didn't attend UC Berkeley or whatnot, and I went to Berkeley, and look where I ended up, UC Davis. So you can see, it doesn't really matter where you are, because the reason why I'm saying this is because a lot of you, I understand, are at a community college, and I think that they're great institutions. And then so you're gonna kind of pick which four-year institution you're gonna attend. And to me, I'm just saying that don't stress out too much. It's a school is what you make of it. So you can go to any 4-year university, and if you make the right moves, and if you study and work hard enough, you can go anywhere. You can go to Harvard med school. You can do anything you want. So it doesn't really matter. And even if you don't go to like a crazy top tier medical school, don't sweat it. They say, from what I've seen, because I've technically completed my medical training. And so, I've seen anywhere along the way, you don't really have to start out at the top. You don't have to start out at Harvard Medical School. You can still end up at Harvard residency, things like that. So anywhere along the way, as long as you get to your final destination and you're happy and you're doing the thing that you love, I really don't think the stones along the way really matter. So, or like that's my perspective looking back. So let's see. And many of us, from my understanding, are from disadvantaged backgrounds with lower socioeconomic status. So obviously, like I'm an immigrant. My parents don't really speak a whole lot of English. Been through all that. I didn't speak a whole lot of English. I don't think any of that should be deterring your future success. I mean, if anything, I think they should be propelling you to much higher success. So that was my motivation. Like in high school, when I was in California, Mira Loma High School. I was kind of in a unique situation where I was taking like international baccalaureate math courses, and I was taking like ASL classes and taking like regular curriculum as well. And so I saw like a wide range of students. Some of whom were heading to Ivy Leagues, and some of whom were not even probably attending college. So my point is that like because of experiences like mine, it kind of showed me like the potential that I can attain. Like I could be like my Ivy League IB friends going to Ivy League colleges, or I can be like my other classmates from a regular curriculum and not going to college at all. So those are like the forks on the road that I could see myself taking. And so obviously when you're shown two examples of like how lives could be, you try to emulate the successful paths, and so I hope I can show you I'm going to be one of the examples of like if so you can, if you want, you can go to medical school and put up with a lot of BS, and then eventually, if you bend over long enough and for a long long enough period of time, you'll graduate and you're gonna do whatever the hell you want. So that's my 2 cents. So just gotta be a little patient and just keep doing what you're doing. So any questions for me? Let's see. I don't know how to even check for questions, but
we'll ask you when it's posted, so don't worry.
Okay. Do I keep babbling on? Let's see. Wow. Do I showcase it? So Q&A. Oh.
What was the biggest takeaway from your Stanford program?
Stanford program. I really wanted to get into Stanford, but I failed too. So that was well, you know, when I was at such an institution, you know, it certainly even for me, it gave me like even more motivation to try to be successful like these medical students that I was that were teaching my classes. So what I got out of it was I got out from that a lot. I met a lot of great colleagues and friends, like some of whom became my best friends ever. So like that I still keep in touch with till this very day. In my amongst my closest friends. So I really urge you to seek out these opportunities and take advantage of them, because I think not only because the summer program kind of gave me an insight into how medical school was going to be. They taught us these abridged courses in for example, human anatomy, biochemistry, and things like that. And they taught us research, gave us, we did like a little pseudo research project, and they gave us awards, things like that. So, a very cross-sectional view of how medical school could be. I mean, it's certainly an abridged version. Medical school was, probably about 5-6 times the amount of volume and of knowledge that they'll throw at you. So, but it certainly gave me a sense of what med school could be, and if I could handle the workload, if things like that, and going to these programs like Stanford, you'll meet the dean of admissions from such institutions, things like that. So that's how you make connections as well. So when you apply, it certainly gives you already gave you a foot in the door. But certainly, obviously, it's in my case and many others, it's not a shoe-in, but I got to the interview, so for what it's worth. But just an example. But just when they read your application, I was in the admissions committee at UC Davis Medical School as well. And what the heck is this? Future time. If we have meeting in the future, what times would you prefer?
It's a poll.
Was that for? Oh, it's not for me. Oh,
That's not for you.
I see. Oh, gotcha. So I think I think there's a lot to take away from such programs. When you're applying to medical school and the interview committee see that you attended these summer programs, geared towards medical school and all that stuff. It shows a level of commitment. It shows that you have done your homework, and you really think about whether medical school would be a good fit for you, and it shows a lot of character, instead of just like, hey, my parents were doctors, and I want to be doctors too, because I want to buy a big mansion like they do. So I mean, I'm not one to talk. I mean, certainly, financial security is should be a logical motivation, but it shouldn't be the only motivation. And so, but yeah, so things like that, admissions committee loves to see. It only helps. It only helps you. So
The next question is, do you have any tips on the application for scholarships at UC Berkeley?
Oh
or
yeah,
just
okay.
tips?
Yeah, great question. So yeah, so I would strongly urge every one of you to apply for as many scholarships as you can, because it's really free money. And like they say, if you don't ask, you'll never get it. So it's like that guy Simu Liu, or what's, I don't know, Simu something, the Shang-Chi guy. So people asked him how he could get a Marvel's hero role, and he said back in 2014 or something, he tweeted, "Hey Marvel, how about an Asian superhero?" And look where he ended up. So similar analogy. So you should seek out what scholarships are available and apply to as many as you can. So that's how I got a few scholarships from during my time at American River College. And honestly, I didn't really know about the Regents and Chancellor Scholarship at UC Berkeley or the UC system. But they just kind of like gave it to me, but that's how I knew about it. But my point is that there are scholarships like the Regents and Chancellors, and there's another one called the Gates Scholarship, and basically it's also another full ride that one of my friends got when I was at Berkeley, and it basically pays for everything as well. So I strongly encourage every one of you to apply for that, and as many as you can. Jubin got me apply to like Soros. Obviously, I didn't get it. Obviously, that's like insane. That's like future Rose Scholar type people. So don't even. But I encourage you guys to apply. Just because I didn't get it, it means nothing. But yeah. Soros is another great scholarship, and you can apply for that. And let's see what else. When you are at the 4-year institution, there are many other opportunities as well. So that's how I found out about the Half Scholars program, because it's a really generous program. It's basically, it gives you like $20,000 to do whatever the heck you want with your research, and I used that opportunity to buy myself a top of the line laptop, and go to Japan for a vacation. Well, for a conference, but vacation. So that's how you should be seeking, you should be doing, when you're at a 4-year institution as well. Is they at any institution, like there are so many opportunities out there, and so much free money, really. So, and when you get these scholarships, and not only that, but the connections that you have, and that's how I worked with Professor Harland at UC Berkeley. He's one of the top developmental biologists of our time, and his letter goes a long way as well. As also like Dr. Kubo's letter, things like that. So that's how you get these really personalized letters of recommendation from people who of such renown, and who know you really well, kind of person you are. So that's my take. So definitely apply to every program out there, and that you can, and pick the best one, basically.
The other question is, did you have an interest in medicine prior to entering college?
Yeah, I did. It's a great question, and it's really never too late to change your mind anywhere along the way, really. So just because, so like, I feel like life is all about finding out about yourself, really. So I realized that I wanted to become a doctor when I was a junior in high school. So that's when I kind of decided, okay, I want to be a doctor, and how do I don't really know how to get there. I didn't at the time, but I knew my next step would be to go to a community college, because I didn't really take the SAT. So yeah, I mean, I didn't really have any other option. But yeah, it turned out community college is super awesome. And so yeah, that's when I realized I wanted to be a doctor. But then subsequently you got to do your due diligence and kind of do your own homework, and kind of like shadow doctors. I did a lot of that through the MBRAF program at UC Davis that Jubin alerted me to. Yeah, there's so many programs out there to let you shadow the doctors and really show you what they do on a day-to-day basis, and whether you think that would be something you want to do. And also, I didn't really know. I was very dumb, honestly. I tell you, if such a dumbass could get into medical school, anybody can. So, when I realized I know I wanted to be a doctor, but I didn't really think about like what kind of doctor. And it turns out there are so many kinds of doctors. If you never want to see a human person again, or talk to a living soul again, you can become a pathologist. But you can still be a doctor. So there's so many choices that will in medicine that you will find that really you'll pick the one that fits your goals and your personality, and you'll see it's very funny. And you'll see once you get in medical school, you'll see there's this really funny picture of the 12 types of medical students done by this anesthesiologist. It's hilarious, and it really fits. And it speaks about like these hippie people want to take who take like cows for payments or something like that. Become family medicine people. Things like that. It's really funny, but in a way, it's sort of like true. You'll see, orthopods, orthopedists. All they want to see is hammer more, things like that. So it's very funny, but it's very true. Like you gotta be really strong to become an orthopedist and hang out with those guys. They all talk about benching and all that stuff. So I realized, that wasn't me. So yeah. So just because you know that you want to be a doctor, your work doesn't end there. When you are at the medical school, you'll figure it out more. I mean, by all means, if you have a parent who is let's say an ophthalmologist, and you're like, oh man, I want to do that. Just want to do that. That's totally fine. So you can make your mind then. That's fine. But
so have you ever thought about practicing medicine in Vietnam?
I did. I thought at a time when I was single, I thought about going to Vietnam and marry a model. No, just kidding. But I thought about it. Doing like international work. But I'm a radiologist. It turns out that it's pretty hard to do international work. Being a radiologist, like teach them how to read an X-ray. Something like that. It's a little weird, but if you were like a surgeon or something like that, it's easier to do international work where you can volunteer to do free surgeries and things like that. I can't volunteer to be like, oh, let me read your chest X-ray for free, so something like that. So it's a little tougher. There are I did look into it. There are one or two organizations that kind of let radiologists do international work, but ever since I had a baby, that just went out the window. So it goes back to my first lesson.
Plus, the other thing is you're a neuroradiologist, so some of the technology that you use here is not available other places for like fine cut.
Oh yeah, I mean, like I can, teach. I mean, I can talk about like how to read a CT head and things like that. It's doesn't have to be like high end and neuroimaging. And but it's not just neuro. I can read. I can read general stuff as well, and I do a lot of that in my private practice here. So not just neuroimaging, but I read a lot of other stuff too. But yeah, it's just a little less limiting or less options to do international work as a rad. But yeah.
So the next question is, how do you decide where to practice medicine? I'm a California resident, but was accepted to an MD school in Texas this
Oh,
cycle.
congrats.
And
All
these
right.
are both great. What factors do you use to determine the place to practice medicine?
Yeah, that's a great question. And
Wherever your wife tells you to go.
first of all, yes. First of all, let me tell you. Great. Jubin knows it. Jubin knows it well. The whatever the woman says, if you really want to be happy and just like keep your sanity, just do whatever the hell she says. So with that in mind, all right, first of all, congratulations. You're gonna do great. Texas is great. Honestly, I'm a Californian at heart. All the politics aside, I thought it was a stupid state, but it's actually not as bad. I tell you, I'm happy here. I'm a happy Texan. I'm gonna turn it blue. Anyways, sorry. So basically, what I'm trying to say is Texas is a great state for physicians. I'm telling you, the tort reform is awesome. It basically caps the amount of money that the lawyers can get from you in a malpractice lawsuit. So that really brings down the frequency of malpractice lawsuits, and I'm telling you. So it's awesome. There's no state income tax, and that is a lot of money if you're looking at a doctor's income. That is not going to Uncle Sam. So and so that's another great reason. So basically the point is like it's not just there are so many factors that go into deciding where you're gonna get a job. First of all, they gotta have a job there, for example, right? If you really want a job in California, let's say Northern California, you gotta be able to first of all, they gotta have jobs there. And second of all, you gotta make sure that the job is right for you. So so there are three things that people say in life, and in terms of like the kind of job you will get, you'll be lucky if you get 2 out of 3. So the first one is basically the money. So the amount of compensation that you think is good for you. And the second is the geography, like where, like if you're a Californian and you really want to be in California, for example, or West Coast or whatever, then that you gotta sacrifice some things, right? And the third one is the quality of work that you want, like your coworkers, the work environment, whether it's non-toxic or whatever. So call no call type thing, all of that. So you'll probably be lucky if you get 2 out of 3. And if you want to be close to family, then you gotta weigh your pros and cons and things like that. So it's there's a lot that goes into deciding what kind of job and where you will end up. So anyways, to give you the reason or given the example of why I ended up in Texas. All right, so my family is from California. My wife's family is from Philadelphia, and I really hated the East Coast. I don't want to go back to the East Coast. So she doesn't like California, so she doesn't want me to go back to California. So all right, so that leaves some other options. And, I interviewed in Washington, Nevada, Texas, Florida, and Oregon. And I went to like over 10, 15 interviews. And then also like just a side note, when you interview for jobs after your training, it's a free ride. So they'll pay for your hotels, and they'll wine and dine you. So I figured, hey, it's free vacation. I should go wherever I want. That looks nice. So yeah, I went to a lot of places, and I could see how different practices were, and whether they were shady or not. And no need to get into the nitty gritty of things for radiology, but basically from that I narrowed it down to three options, and one of which is in Texas, and that's my top choice. So the other options, one was in Seattle, but my wife couldn't take the rainy weather, and the other one is in Las Vegas, and she didn't want to raise a family in Sin City. So see
what is your perspective? Oh, sorry.
So basically, like Chuban said, whatever the wife says, that's where you're going to end up. So
what is your perspective regarding physician assistants and nurse practitioners and scope creep? I don't think radiology has PAs, right?
We do, especially interventional radiologists. Yep, they do. They use a lot of PAs, but for diagnostic radiologists, not as much. But because diagnostic radiologists, we just sit on our butt and we just read. For interventional radiologists, they do a lot of procedures, and PAs and NPs can help with that. And I think it's a great addition to the medical staff, and I think it's they do a lot of great work, and I think personally, I also think it's a very good option. It's a much shorter training, and much less expensive. And one of my good friends from the Stanford program actually ended up becoming a PA, and she got a full ride to Duke or something for the PA program, and she's really happy. So I think, and then she's super smart. Bioengineering at UC Berkeley, that's like a death sentence, and she survived that. So yeah. I think it's a great option.
Can you talk about financial managing in medical school and after med school? I just read White Coast Investors, and it seems like we should live very frugally in medical school residency in a few years to manage your financial success.
Oh my goodness, sheesh. Dang, you are wise beyond your years. Shoot. I didn't even know about the White Coat Investor until I graduated from medical school. So shoot, you're way ahead of the game there, girl. So good job. So basically, I think it's great. It's something that is not taught in medical school at all, and White Coat Investor, or there's a lot of other doctor podcasts out there that talk about financial success and financial independence, and making wise decisions and things like that. And definitely there are some rules of thumb that you should try to go by, but it's certainly not like oh, what the, sorry, I'm trying to figure out how to get back to this. Anyways, but yeah, so basically you can you should listen to these podcasts as much as you can without them be sidetracking your studying and all that stuff. But definitely read up on that stuff as soon as you can. And basically it boils down to, hey, don't go buy a Lamborghini on your first day on the job. So that's kind of the take home point. And there are a lot of other details, but basically, it doesn't mean that you can't reward yourself after so many years of training and things like that. But it should be within reasons. And these podcasts and all these really smart people will give you some guidelines and some rules to follow, and you just based off of that.
But the moral of the story is: did you ever starve in medical school, residency, and post-residency, and were you ever homeless?
Oh, dude, you just look at me. You should definitely know I'm not starving. I'm the opposite. I should be eating way less. But yeah, so no, I did not starve. Well, you gotta go on dates. Come on. So you gotta not only not starve, but you gotta feed your significant other. So
how did you choose your specialty?
Oh yeah, it's a good
Or how
question.
do you choose different specialty? I don't understand the whole.
It's a great question, and I kind of alluded to that earlier. If you certainly got motivation from your parent or something like that, mentor that who is of a particular specialty, and you shadow them, and you kind of know the ins and outs of the specialty and their day-to-day work. And if you think that, hey, that you're saying, hey, that totally is me. That's exactly who I want to be. That's exactly what I want to do 10 years from now, whatever. Then by all means, go by that. But it's certainly not the end all be all. I have seen many people switch specialty anywhere along the way. Even after, like one of my radiology co-resident back in New York, he was an ENT for what 7 years, 8 years, and he was like, I just don't want to do this brainless job anymore. He's like a super smart guy, like my goodness. And he said, he wanted to do something more cerebral, and it requires more thinking, more logic, and all that stuff. And so he went back to a residency, a radiology residency, and yeah. So just to give you an example, for me, why I picked radiology, I'm kind of an introvert, and I think radiology is really good for introverts, or more specifically, extroverted introverts. So I think you gotta not mind here. Let's see. How do I turn back? You gotta not mind these monitors being your besties for 30 years. So you don't mind talking to these monitors for 30 years, then that's one sign that you should be a radiologist. So
can you tell them what those are?
These are monitors. Just kidding. So this is like a work list. So you can see in my practice, you can, there's always things to read. And so, you can read after hours. You can read after hours study. and I make some extra money for gas and things like that. So, you know, if you're a radiologist, my tip is to pick the MRIs. They're high RVUs and they're, you know, they make more money. So, anyways, just kidding. But that's my work. So basically, if you don't mind doing this kind of thing and just sitting in front of the monitor, or you know, not just saying this, but you know, there are a lot of different options for radiologists too. So you can be an interventional radiologist, and yeah, I don't know how to do that. Let's see. I don't know how to turn it off, but let's see. Yeah. Let me see if I can turn it off. Hold on. Give me 1 sec. Let's see if I can turn it off. Let's see. Text overlay. Yeah. All right. There we go. All right. Good idea. Yeah. So, so that is you know, an example of a chest X-ray, not a normal one.
Your camera went out.
Oh.
There you go.
Wait. Okay. All right. You guys see it? All right.
Yes.
So that's a chest X-ray, and you know, that's you know, could be. Anyways, I won't go into the details, but you know, you gotta not mind reading this stuff, and you gotta find joy in it. And for me, I do. It's very fun, and I kind of figured it's let's see, let's pick a brain because I love brains. Let's see. There's somewhat normal one. Let's see. Is one okay? All right. So this is a brain. Let's see. Hold on. Give me 1 sec. Let me make sure that the patient's name is off. Let's see. Takes overlay. All right. Cool. So this is an MRI brain, and you got, you know, radiology, diagnostic radiology is about basically being Sherlock Holmes for the medical field. You're kind of the first line of making diagnosis or differential considerations of what might be causing the patient's symptoms. You got to put everything together. You got to put in, you know, you got to combine with, you know, your the lab work and things like that, the patient's history, presentations, and how they look, how they appear on imaging, and basically combine all these clues and say, hey, I think this is what's going on. This is the leading consideration for what's causing the patient's symptoms, and the you know, the other two choices would be B and C, and do these things. So that's what drew me to radiology, is like you're able to you're able to help out on so many patients, and also, you know, you have to know so much, and you know, that's the thing that's really rewarding about it, is you have to know a lot of the rare diseases that, you know, most, you know, internal medicine doctors or surgeons or things like that, or even specialists in their fields, or, you know, oncologists might not have seen what might not see in their lives, but you have to know about them because you'll likely see them on imaging and in your work career, because you'll see a lot more patients than they do, because you know, you basically, you're reading the cases, and you read like hundreds of cases, and not a lot of doctors see over 100 patients a day. So you'll basically see, quote unquote, a lot more patients than other people, and you'll see a lot more pathology than other people. So that's what I like about radiology. Is it's very fun, and it's a detective kind of work. So that's my why radiology.
What are some
Sorry.
of the challenging things as a radiologist?
Challenging things. Well, you got to put up with DVTs because you're on your ass all the time. Well, let's see. So turn back. Well, no, it's like it's just like anything. It's just not really challenging, but you gotta be okay with sitting in an office by yourself. If that's gonna be your line of work, and I don't mind. Other people do, and so they go into academic radiology where they can teach other people and be more social, which is fine. But I just like to keep my stupidity to myself. I don't like to teach people. Yeah, so challenging. What else is challenging? It's like just like any job, like for example, I drive a lot. I have to commute a lot, and then to cover because they need a radiologist on site for contrast reaction, basically. So they need a radiologist at each outpatient imaging center, which is why I have to drive, quite a bit of distance. So sometimes I may have to I drive like over 120 miles round trip in a day. So those are some of the challenges, but it's certainly not unique to radiology. So like I don't really know what else is like so specific to radiology besides the sedentary lifestyle and basically sitting in a dark room. Yeah, some people like don't mind sitting in a dark room. Some people do. I don't.
What about your eyes?
My eyes are fine, just a little nearsighted, but my eyes are fine. I don't get eye strain or anything. Some people do, but these are good monitors. The Barca monitors, and so it certainly reduces the eye strain, but it's not for everyone. You'll see when you get into medical school, but.
And the other question I have is, so you basically just, what do you do in a day as a radiologist?
Yeah, so for my practice, it's a huge group, and basically I cover a lot of the outpatient imaging centers. It's called touchstone imaging, and basically most of the time I just do diagnostic reading, like X-rays, ultrasound, MRIs, CTs, things like that. Basically all modalities, not just neuro. I do mammo as well, so I read mammo, and I also do procedures is another thing. So private practice usually requires that you do a certain amount of procedures because they can't afford to switch people back and forth, and it's a lot of hassle. So it really helps out if you can do procedures, and I can do neuro procedures like lumbar punctures, myelograms, things like that. Also, and also this private practice requires that I do a lot of orthograms, biopsies, like bone marrow biopsy, orthograms, and like esophagams, upper GI studies, basically fluoroscopy studies, and so I do that. And some of these you're not gonna feel like super comfortable about, but you kind of pick up the muscle memory again from residency pretty quickly. So you basically my job and like anyone's job really, it's kind of, you got to be a little more fluid in your work life, because it's not going to be like the exact picture that you had in mind when you graduated and you took the job. And so there are gonna be different things that people ask you to do that it might be outside of your comfort zone, but you learn and you give it a good shot. And if you don't do it right, they'll say, hey, this is how you can improve it, and then you improve it, and then you'll be good. So that's
If
how,
you didn't do radiologist, what else would have you done?
if I didn't do radiology, let's see, for extroverted introverts, probably. So I actually really liked ophthalmology. So ophthalmology is really awesome. You get to do microsurgeries, and I think the eyes are like awesome. The eyes are awesome and very important. And so it's the only cranial nerve that you can see with your naked eye. So with assistance from special equipments, but it's really cool when you look under the eye, into the eyes, around the eyes, do surgeries all over the eye, and it's pretty cool. But there's pros and cons for every specialty. So and opto is not easy to get into. It's pretty competitive as well. Let's see, what else would I be? I could let's see what else I liked. I did not like a lot of things, so I can tell you that. So you'll see that everyone's different. Just because psychiatry, for example, is not for me, or OBGYN is not for me, doesn't mean it's not for you. So you'll see when you get there.
What are some of the things about your job that you love?
Oh, beside the money, just kidding. So like I was saying that I love my job, honestly. I just love making diagnoses or diagnostic suggestions and direct. Basically, radiology is the thalamus of medicine. So we are the focal point of medical care, because the initial diagnosis and all medical specialties kind of converge to us to basically guide their clinical decisions and clinical makings, and so I think that's the part I like about it, is that I get exposed to many different specialties and helping them out. So like oncologists talk to me, surgeons talk to me, neurologists talk to me, things like that. So you're helping direct care, and not just that, but because of your wide range of knowledge, you're very if radiologists, people think radiologists don't know crap because you're not a real doctor, but contrary to popular belief, we know a lot more about medicine than other people on average. So in that sense, like if your family member ever needs like medical care or medical attention, a radiologist is someone that you want in your family, because they know a lot, and they know what to do, and what studies, what to get, and what it means, and when the result comes out. So that's what I think I like that privilege of the job, as well as when my parents get older and already get sick. For example, my mom fell about a year ago and broke her wrist and things like that. So she got imaging and things like that. So I would tell them what to get and what it means, what CRPS means or things like that, and whether she would need surgery or not, things like that. It's it certainly opened my eyes to the perks of being a radiologist. So
The other question is, how do you manage burnout?
oh, I'm already burned out, so I don't really know what to tell you. I mean, well, you just gotta there's so many different ways, my friend, like my friends always talk about fire. And for the smart kid who mentioned the white coat investor, I mean, those podcasts, they also talk about burnout and how to manage burnout. And one of the reasons why they started those podcasts was because they were burned out. So just so you know. So, but pretty much everybody gets burnout. The thing is, like, whether you're gonna quit your career prematurely because of burnout is another question, or whether you seek other ways to manage that and then try to make it to 30 years or win the lottery ticket. So I get tired, radiology takes a lot of brain power, in terms of like cerebral processing and things like that. So you get, even though you don't do a lot of physical work, but you get really tired at the end of the day. You'll see what I mean if you ever become a radiologist. It's a lot of because like vision takes a lot of energy, and you have to and you have to use your eyes a lot, and also you have to use your brain, like, hey, what could this be, what could this be? And I gotta pay attention, I gotta be focused, otherwise I might miss a cancer, I might miss a lung nodule and things like that. So it's a lot of like high concentration work, and you get tired if you do that, 10 hours a day, 30 years type thing. So, different people find different things that they enjoy outside of work to help themselves. I personally like gardening. I was fortunate enough to get a house with a decent sized garden and decent sized backyard. Because I wanted to do a lot of gardening, and I'm very aged, and I want to plant a lot of fruit trees and yeah, yada yada. But anyway, so whatever fits your cup of tea, I certainly urge you to pursue those and try not to get burned out. A lot of doctors play golf, so hey, if golf is your thing, you should totally do it. I guess I'm not a real doctor. I don't play golf. So.
And this one is, what were some of your study tips in your undergraduate and medical school, and what worked for you?
That is a tough question. It's a great question, but I don't have an answer that fits everybody. Because, right, as you know, everybody is a different, has a unique learning style. And my learning style might not fit your learning style. So first of all, you gotta know what you kind of try to figure out what kind of learner you are, and what type of learning style fits you best, or whether you're a procrastinator and you love cramming, and cramming works for you. And I think that's great if cramming works for you. I gotta tell you, cramming in medical school is not gonna work unless you have those unique brains that have eidetic memory, and you absorb things like a sponge, and you don't leak any information. So cramming won't work in medical school. But whether you're good at cramming, or whether you're good with studying by yourself, or that you you can do fine studying in a group. Because it's things like that. All these different things you got to figure out. Is studying in groups good for you, or is it gonna just gonna be distracting and you're not gonna get anything done? So you got to figure out all that out. But at the end of the day, if for example you're not getting the academic success that you were hoping for example, and despite all your hard work, then you got to go back to the drawing board and see why you're not doing as well as you wanted to, despite your hard work. And you got to figure out, like, is it because I'm not understanding the material correctly, or you're not studying efficiently enough, meaning you study a lot, but then you're not absorbing the information, or whether you're not getting enough sleep. For example, sleep is very important, as for consolidating information and things like that. So if you're not getting enough sleep, I guarantee you, some people it's fine for them, but I think it's very important to get enough sleep. Don't pull those all-nighters. I know you kids have the energy, but just listen to this old man. You gotta get some sleep.
Did you ever get a low grade in your undergraduate years, and how did you handle it?
Oh, that's a great question. Yeah. So I tell you, I got my first B at Berkeley, and I tell you, that's why I no offense to the social science people. I hate social science. I gotta tell you. I mean, to me for that B, for example, I was like, I pour my heart out on the stupid essays. Like I wrote everything that they basically to me. I wrote everything that they asked or they provided us in lectures for those questions, and basically I just got a B, and I'm like, there's no explanation, anything, like, it's basically very subjective, like, so how do you, so then like, how do I like debate that? Like, I don't even know how to like improve on my performance if I wrote everything down that they taught in lectures and I got a B, and like, I don't know, what do you expect? So things like that, I don't really know. So like how to improve on myself if I don't know what was wrong. But that as being as put that aside. In general, you're basically, it's a great question, and your GPA and your grades are not the end all be all for your medical school application, which is the main goal for everybody here, right? Is to get into medical school, and that's why you try so hard to do well in your classes and stuff like that. But just because you got a B or a C or a D or even an E, F, G, it doesn't ruin your life. I kid you not. There are so many. I mean, I was fortunate to talk to a lot of medical students during my undergrad years, and some of them were from Stanford, and and some of them like didn't really start out having straight A's and things like that. They were having like straight C's, for example, for different reasons, and everyone's life and journey is different, and just because you started out not on a very high note, it doesn't mean that you should end on a low note as well. So just show progress, right? So you don't want to be showing them like this, right? You want to be like, hey, I started out as a C and I went like straight A's. Now that is something that medical school admissions committees want to see, is that despite my hardships, I fixed that, and I found why, I found out the reasons why I wasn't doing well, and I addressed that, and basically I could prove to the medical schools that I can I can take tests, I can learn, I can do the work, and that's what they want to see. And they don't want to see like, hey, straight A's. Well, yeah, I mean, of course, they like straight A's and all that stuff, but not having straight A's does not mean you can't get into medical school. Same thing with the MCAT, same thing with everything else. Your application is the entire application, not just your grades, not just your MCAT, for example, not just your GPA, not just your MCAT.
So when you
don't
were
let
on
it-
the admission committee, what did you see that helped people be successful, and what caused people to not get accepted?
Oh yeah, well, just don't be a jerk. Uh, that comes off really quickly. I mean, you can screen for jerkiness very easily, and there was I think let's see, we had when I was in undergrad, we had driven organized some admissions people come over to give a talk, and one of them said told us about this guy's application to medical school, on the reasons why he wanted to go into medical school was because of the money and the chicks. So like, I mean, like, you gotta keep it on the down low. No, just kidding. But you can't be saying stuff like that and then expect to get into medical school, right? Obviously, I'm sure none of you will be saying something like that. But like, basically, what I think helps people become successful in their application and their journey is basically just being honest. Honestly, just be honest. Like, hey, like, for example, like, you can just tell your story. Hey, this is why I want to be a doctor. And I want to do X, Y, and Z. Oh, okay. I want to do X, Y, and Z, and I want to be able to like, in 5 years I want to do the A, B, and C, and this is where I see myself in 10 years, and be honest about it. And you don't have to be with the fortune teller and know everything, but it shows foresight, and it shows that you're mature enough, and things like that. So just be honest in your application, and don't appear like you're making excuses. For example, like like, if you got an F in whatever, and say like yeah, sorry, I was drunk that night, had one too many drinks, and forgot to take my final. Oh, that's just me. So anyway, so like something like that, don't be making excuses. Just say, like like, this is what happened, like I was going through like whatever hardship or whatever, and and then like I corrected it, and my grades improved, and shows that I can do the work. So something, like, that's an example, but basically, don't be making excuses. Just tell them like what your real story, and then I'm sure they won't have any problems. So, and you'll be fine. So okay, yeah, that's it. Any other questions? Let's see. What books? Juven, you still there? Yes.
Why did you choose UC Berkeley for undergrad and UC Davis for med school?
Oh yeah. So it's a great question. It's basically, so like, it kind of boils down to, the real answer is it shouldn't matter. Really, for you, I'm doing maybe yeah. Yeah, basically, so the real answer is basically shouldn't matter. Any if you can get if you can get the right amount of education for the least amount of money, that's what you should go for. If you shouldn't go for the name, you shouldn't go for whatever. But if it gets you from point A to point B with the least amount of money owed, I think that's the winning ticket. So that's how you should be picking. I mean, don't go. I mean, anyways. So what I mean by that is like my story of why I ended up at Berkeley and UC Davis is really not helpful for you. More so than what I think might help is that you can become the specific doctor that you want in the most efficient path and the least amount of money owed. I think that's the right path to go, because you don't want to. You really don't want to go to like some fancy schmancy schools and then end up with like $600,000 in debt. And then, I mean, I guess if you really, if Harvard is your thing or Stanford is your thing, and by all means do it. I'm not trying to discourage that. It's just to me, looking back, I was that kind of guy, right? I was all gung ho about Stanford and all that stuff, but anyway, so my advice is that you try to graduate with the least amount of debt and the most amount of knowledge is my advice. Why I ended up at Berkeley is because they gave me the Regents scholarship, and I messed up on my transfer application for all the other UCs, so I got rejected by all of them. And anyway, so they didn't get my grades transfer updates, so they rejected me. So that was the only school I got into. So that's how I ended up at Berkeley. And I appealed and for UC Davis, and they accepted me, but then they said they already gave out all their Regent scholarships. So that's why I ended up at Berkeley. I ended up at UC Davis was because it was one of the first medical schools that I got accepted to, and it's close to home, so I can save on some money. So that's how I ended up there. But yeah, I don't think my stories would pertain to you, but yeah, just keep that in mind. Okay, my AirPod died, so let's see. Video.
This is another question. Do you think joining AMSA or any pre-med group did help you as a pre-med, and in terms of opportunities and applications, did that help you?
Sorry, what was that, Jubin? Sorry, I was trying to.
Did you think joining AMSA was beneficial, or any other group for being a pre-med, and in terms of opportunities and your application for med school?
Sorry, so the question is whether I think going to community college.
No, being part of AMSA or any pre-med group, was it beneficial for your application?
Oh, yes. Yes. So it's a great question, and I think what the bigger question is, yes, obviously it really helped me, but not because I was doing some kind of checklist. I joined AMSA because I wanted to be amongst people who have the same goals and same paths and things like that. And it's like joining a community and kind of like know what to do and things like that, get advice, and it certainly helped me, and helped me meet Dr. Kubo and other great people. But the bigger question is, yes, it will look good in your application, yes, but don't join 1,000 clubs or whatever, do X, Y, and Z and 1,000 other things as a checklist. That's something that people will see through if you try to do that for medical school, and you get involved in a million different things, but everything is like within 2 weeks or whatever, 1 week or something like that. You want to do things that you're really passionate about, and kind of do it for the long term, kind of show some commitment and some dedication to whatever you're doing, and become a leader in your organization, for example, is a great way to show dedication and commitment, and they all appreciate leadership skills in medical school, so, and in your future career. So it's important that you do quality things, quality extracurricular activities instead of 1,000 of them. But yeah.
The other question is, what books did you read when you were in in undergrad, and which ones would you recommend?
Man, that's kind of tough. It's kind of tough. I didn't read a lot of books. I just read the syllabus.
No, like outside books, like as a pre-med, like there's some books.
Yeah, like I mean, I read a few books like when the air hits your brain or something like that, and a few other books, but just out of my own curiosity and interest. But you don't have to read any of those if you don't like or don't have time for, or things like that. Just do well academically. Or and try to have some fun, and not too much fun. I say, but I guess if you're a very efficient person and can handle everything and still have a lot of time for fun, then I really applaud you. Like my college roommates who went to Harvard Law, and all I saw was him talking to his girlfriend on the phone. And watching Colbert Report, but man, that guy's a genius.
So this is a question. We've got some of those. We have a presentation on the 27th about shadowing, but what kind of advice do you share about shadowing experience during COVID? And do you know of anything in your neck of the wood about shadowing during COVID?
That's a great question. I honestly don't know of any. So I kind of work on the private side, on the academic side. I don't really know how my colleagues are handling that. My group is a hybrid, and there's an academic portion and there's a private portion as well. I don't deal with the residents or medical students or trainees.
Pre-meds, I mean.
Or pre-meds, that too. We did have, back in residency, we did have pre-meds and things that, college kids shadow us, but that was pre-COVID. I don't really know. You probably had to reach out to your options and see how they're handling it. I'm sure it's different for every organization, every school, every hospital. So it's a question that I'm sorry I don't have the answer for.
All right, and then this is the last one. Is this is one more. What are the tips in making residency applications more competitive? And I think this is such a far removed thing, so if you just talk that for a few minutes, like.
Yeah, I'll be brief. So it's in the future. For example, if and it's going to be very specific to what kind of specialty you want to do. For example, if you want to become a family medicine doctor, you can just chill and throughout medical school. Just make sure you pass your courses and you'll become a family doctor. It's not that competitive. So it really boils down to whether you're looking to become and to do one of the more competitive specialties. So I heard that these days medical school, even the step 1 exam is pass fail. So the only thing that will really separate the medical students at this point from what I understand is just your research and your letters of recommendation. So if you're looking to become do one of the more competitive specialties, I would imagine that you'd have to dedicate a significant amount of time doing research and publish during medical school, and kind of shadowing the kind of doctor that you want to be, and really show that during interviews.
And advisors and mentors
Yeah.
in medical school.
Sorry, what was that?
Advisors.
Advisors, yeah. Advisors and mentors. Yeah. Mentors, yeah. In medical school. Also very important everywhere you go. Even for your real job, you'll have older people that will guide you. So yeah.
All right, any other questions, please type them in the question. We try to answer all of them. Because if not, Dr. Lam has to go because he's got husband duty.
Yeah, the boss is kind of yelling at me. So yeah. So happy wife, happy life. So any other email me, things like that. So
is it okay to share your email?
Sure, yeah. That's I put it in the Q&A.
Put it in the chat.
Okay, let's see.
I'll put it. Never mind, I got it.
Oh, cool. Thanks, man. Yeah, LinkedIn. Sure. Yeah. Sure. I don't know how to give you my LinkedIn, but I can email.
I just put your email in the chat, so anybody that wants to take it down before we leave.
Yeah, and then we can connect however you see fit. Yeah.
All right. Well, thank you, Dr. Lam, for coming.
Oh, sheesh, you man. Stop calling me Dr. Lam, bro.
And thank you for coming. I know that you have other things to do, and I know that, but we appreciate you coming, and appreciate everyone else for making time today to come. And